as a society, we've all of a sudden gotten really good at weight loss, something that we've been fighting and fighting and fighting for decades. This medication has allowed it to be doable for many people. And because of it, we're seeing it. And unfortunately, I tell all my weight loss patients this, you don't get to choose where the weight loss happens. So you're going to lose it in the spots that you may not want to, in the face. You may lose it in the butt. You might lose it in the boobs. Unfortunately, wherever we carry fat, you'll lose it. And so, you may need an augmentation in those areas. And Lindsay's seeing that more and more in like facial cases. And then they sometimes get to the point where they're so extreme that they may need a facelift early. And
Mhm.
we did a recent podcast talking about face and how, is what's too young for a facelift? Well, that whole thing is thrown out the window because now we're seeing young patients who are losing 100 pounds. And unfortunately for them, that means sometimes extra skin in that area. And so we're finding that we're needing to facelift earlier because their skin is there. They've lost all this weight. It happens. Then there's, body contouring portion of this where you just have a lot of skin. What we say in general is you should be stable in your weight for a good 6 months, 6 to 12 months before we think about operating because number one, we want to make sure you're stable and you're not losing more because
Mhm.
you wouldn't want to go through removing skin and then you have more skin.
No.
But we also don't want to see you gaining it very quickly back too. And then, you've gone through this procedure and then you may have, you're kind of back to square one.